Hi, everybody. My name is Terry Love, and I'm here to talk to you about injury prevention in state health departments. This is a field I've worked in for about 20 years, partnering with and/or working with health departments across the United States. For the last 10 years, I've served the Tennessee State Health Department as the Director of Injury Prevention Programs, but I'm here representing myself and my experience working with health departments via regional and national leadership groups like the Southeastern and Southwestern Injury Prevention Network and the Safe States Alliance. One of the things I want to prepare you for in this presentation is the amount of variability from state to state when it comes to the injury and violence prevention. Um, this is a high level overview of some of the key things that you should be aware of. It's not comprehensive, but it should get you started on your journey with state health departments. So, typically in state health departments, there's a variety of topics covered in injury and violence prevention, ranging from unintentional injuries to interpersonal violence. State health departments are funded from a variety of sources to create conditions where these injuries are less likely to occur. Some of the most common topics include concussion, traumatic brain injury, fall prevention, burn prevention, poisoning and poisoning prevention, or suicide prevention with regard to interpersonal violence, maybe bullying, child abuse, domestic violence, sexual violence. You may find that your health department in your state focuses on one or all or some of these topics, as well as collecting data, injury outcome data for topics such as ACEs, morbidity, mortality, disability, overdose, suicide, etc. One of the major functions that state health departments typically do is they do track data. So even if your state is not involved in a wide variety of injury prevention, they are likely tracking data and can provide you with the data so that you can become involved with injury prevention. Some states have well-established programs to address particular topics. For example, in Tennessee, we have a well-established sports injury prevention program to prevent traumatic brain injury, heat illness, cardiac arrest, etc. And this is called our Safe Stars initiative. We have multiple partners. We're funding and supporting programs to evaluate this project, to spread the project, and we support legislation that requires schools to adopt various program goals to prevent these injuries. So your state may have other kinds of programs that they have kind of a model program that they're promoting, or they may have multiple programs. But the key thing for you to do is to contact your state health department to see which programs they're working on so that you might become involved. Another thing that you need to be aware of is that many state departments, they may not be conducting the programs themselves or housing the programs, but they may be funding the programs or working with other multi-sectoral groups by specific topics, either through task forces, coalitions, advisory groups. And so, even though your state health department may not be actively leading the project for injury, they will likely know who in the state is making progress in those areas with regard to injury prevention. So you should know a little bit about the structure of programs in state health departments, and they can really vary from state to state. In my experience working with partners, different state partners around my region and around the country, that's become evident. Sometimes in the health department, you'll see the injury and violence prevention program in very different divisions or branches or units or bureaus. Sometimes it's just learning the language of your particular state health department to know how they're structured. So, for example, when I was in Arkansas, we had what we called branches, and it was like the branches of a tree. In Tennessee, we have divisions and programs. And so sometimes it's just learning the organizational chart, how it works, that will help you understand how things are structured. Um, One thing you can do is you can you can use the link provided here to check out by state or territory what the contacts are for the different state health departments. And I encourage you to find your state or read or states that can connect to your state and find out who those folks are and contact them to learn more. Again, in Tennessee, we are housed in the Division of Family Health and Wellness, and I'm very fortunate in that many of our injury prevention efforts are also in that same division. And we have a section of the injury prevention and detection, and within that section, there are multiple programs. And so those programs, one of which is the injury prevention program, or the core SIP program, or the CSP suicide prevention grants. These are housed in that section and in those programs. So your state may vary, and sometimes suicide is in mental health, and injury prevention is in Department of Health, or you may have substance abuse taking a role in that state. So we'll talk more about that in just a minute. But the key thing is to don't give up. If you haven't found injury prevention in your Department of Health, there's some state department that's probably working on it. And I would just say, uh, find your state and find the folks in your state who are doing the injury prevention by using that list that I provided, and and find out those folks who know who's working on other things. So anyway, I would encourage you not to be afraid to contact those leaders or contact your state health departments to see if they can direct you to the specific injury prevention program that you're seeking. So typically, um, the state health departments, all state health departments tend to use um, these basic kind of steps as they work through their injury prevention programs. It may vary. Some state health departments will have more strengths in one area than others, but for the most part, all state health departments will work this way. One of the main things that state health departments should do, as I mentioned, is they do data, they collect data, they surveil data, they keep records of data, and this is where our epidemiologists come in. And if you're fortunate, your state health department will have multiple epidemiologists who really are subject matter experts in data, and they are tracking these various injury indicators and providing those indicators to the public. And we're very fortunate in Tennessee, that we have some wonderful epidemiologists that help us really keep our finger on the pulse of the trends that are related to injury and violence. And then, secondly, state health departments also do a lot of communications work, building awareness around different issues using social media, earned media, providing fact sheets, or disseminating data. We do this in meetings. We do this in press releases. We do this again with our social media um, outlets. And most health departments engage in some type of work like that. And this may be where you first learned about your state health department injury prevention efforts. The third thing is the state health departments work closely with community leaders. I really could not function without a good coalition. We have an injury prevention coalition in the state of Tennessee. I also serve on multiple injury prevention groups like the Occupational Protection Task Force, or the Committee on Pediatric for Emergency Care, the Trauma Care Advisory Council. These are all multi-sectoral groups of state leaders, statewide groups that play a role in injury prevention. And your state likely has similar groups. Um, Sometimes we're, as the Department of Health, we're developing those coalitions from scratch, or those task forces, or those advisory groups. Sometimes, as a state health department, we are just supporting an existing one or revitalizing an existing one sometimes based on funding, sometimes based on need. So look for in your state for those efforts. Another thing that state health departments do is provide training or technical assistance to existing programs. That could be in the guise of suicide prevention training, or it could be just teaching people how to access data, or how to develop programs from scratch, or how to evaluate existing programs. In Tennessee, we provide all those services to our partners, and then we also share the resources that other partners share with us to our partners. So it is a communication hub, so to speak, for injury prevention work. The next thing we do is we may actually provide curricular evidence-based programs or printed material to support existing injury prevention efforts, or technical assistance in terms of improving programs or continuous quality improvement. for programs. So reach out to your state health department to see what opportunities they may provide. And then another piece that state health departments engage in is policy input or regulatory oversight. So, for example, in Tennessee, we're monitoring policy all the time to see what injury prevention policy may be coming down the pike or what injury prevention policy has changed and how we need to react to it. And we can provide guidance to our partners um, to address public health issues based on how new policies happen or what has happened and what needs to be done. But there's a lot of things that you need to understand around policy input with state health departments. Typically, state health departments, we're really not in the business of advocacy in the sense of we do not lobby. We provide information. We can provide examples of evidence-based programs. We can share information with our partners and with legislators if requested, what works and what the best practices are, but we never lobby. And a lot of it has to do with the way we're funded. And when you're funded with federal funding, as most state health departments are, you are not allowed to do lobbying for specific legislation. And then your state health department also, one of the big things that we do is that we share evidence-based programs and we do procurement. So procurement is a word you may not have heard much about, but basically this is how funds and resources come from the state health department to the local partners to conduct injury prevention work. So, for example, if you're considering a career in state health work, state health departments, you will need to understand procurement one way or the other because the part of your role will be um, um, contracting. So procurement is where it's a process by which a state health department will contract for state programs and services. And this is also how we determine who gets funded, who gets what kind of funding, where the funding goes. And so this procurement process sets up contracts and a scope of work that allows us to, and other funders, to determine how these programs are executed at the local level. Usually, these are state or federal funds that pay for the contract state procurement. So, um, if you're a local level person and you're working in a local community and you're curious about how to receive state funding for your effort, then you're probably most likely you're going to contact the state procurement department and figure that out through those auspices. So, but as a grantor, we're not usually doing a whole lot of direct services. We're usually overseeing someone, an entity that does those direct services, does provide those direct services. And the way we get those services in place is through our procurement process. All of these tasks, and again, this is not a detailed list, they contribute to, identifying a problem, educating the public about a problem, developing partners to address the problem, providing the training and resources and maybe policy support, education anyway to change environments. So, and then we may provide funding to local entities to then deliver these kind of prescribed efforts to the community that will actually change public health behavior. So the goal is data to action. So we get the data, we know there's a problem, and we use all these skills and all these methods and all these strategies to address the problem that we've identified by data. And then we monitor whether that changes or not over time. So this is how state departments work, state health departments, yes. So just a couple of programs that I like to talk about from the Tennessee Department of Health to give you an idea. And I mentioned this before, which is the Safe Stars Initiative. This is an initiative which was initially started to support local sports organizations, and then it morphed into let's support the schools to reach best practices, and then later became legislation that mirrored the Safe Stars initiative. So we now have the Tennessee Safe Stars Act. So one of the goals for us now is to provide these kinds of resources to schools and other organizations to meet the act, the actual law and regulation. So you know, most states have some kind of youth sports concussion law, but our law is comprehensive in that it talks about all kinds of sports injury and prevention of those things. And so our Safe Stars initiative. If you Google that, then you can learn about how we do that in Tennessee. We're very proud of that. And this is a good example of using all the techniques that we just talked about. We're supporting schools and organizations to meet the regulations, and we provide a ton of technical assistance and cost-free resources. We try to keep our program. We're trying to find ways to do it so it doesn't cost any school or any individual anything to meet the standards. And then basically working with our partners, which is the Tennessee Secondary School Sports Athletic Association, the Tennessee Department of Education, and other state agencies I'll talk about in just a minute, so these schools and others can meet these requirements. And then we give them a reward if they meet them, and they're recognized at the bronze, silver, or gold level. And so we've had some success with that. Other things that happen in most states, most of your states will conduct a child fatality review, both at the local and state level. Tennessee does this, and we share this data with multiple partners. It is one of the core functions for us in terms of informing partners about what the needs are for injury prevention programming in their region and at the statewide level. And your state might likely has this same review process and probably produces a child fatality annual report where you can glean that data. Another program that we're proud of that is we work closely with the Highway Safety Office and others in schools to develop a parent-teen driving agreement program called Checkpoints. This is for families of new teen drivers. We've had some success in spreading that, and we've seen some really good behavior change as a result of that program. And in Tennessee, we're fortunate enough to receive CDC funding to reduce suicide, and we collect and share real-time data through our Essence alerts about ideation and attempts and suicide fatality. So we're very fortunate in Tennessee, and those things are housed in our section. So we're very fortunate in that way. Your state may have those similar kind of programs, or they may not have that funding, but they may have different funding that we don't have, maybe to support things like safe spaces or zero suicide. But these are common things that state health departments do. But I would just encourage you again to check with them and see what they're doing. And you might find that there are others out there who share your passion for a particular topic. Some successful key partners. Now, I mentioned some of this before, but in your state, most states work very closely with other different departments. So your state health department may work very closely, as we do, with the Department of Mental Health and Substance Abuse, or Department of Transportation, Public Safety, Department of Ed. In Tennessee, we have Tennessee Department of Environmental Conservation, and TDEC has helped us. One example would be they helped us distribute drug drop boxes across the state. We went from 35 boxes to more than 350, 400 boxes just in about 6 or 7 years. But it is a long game. It's a slow game, but we've made some great efforts along with our partners. There are other kinds of partners, such as coalitions. I mentioned the Committee on Pediatric Emergency Care. We have Safe Kids coalitions in our state. We have community-based organizations that do private nonprofits, all kinds of organizations that we really try hard to get them to be on our injury prevention coalition at that high level, so we can keep our eyes and ears open for partnership opportunities. And I would encourage you to look for those as well. And then we have, again, the medical providers. I mentioned the Trauma Care Advisory Council. Most trauma centers are required to have some type of injury prevention outreach program. And so your state likely has a Trauma Care Advisory Council or something analogous that you could reach out to and contact and see how their programs work and what their injury prevention efforts are in your state. But it is, I just can't express to you how effective it is to connect with others and learn the history of what's happened about your particular topic, or what are the current efforts and what are the resources, what's happening now around the state, so that you can become aware of that and connect to them. But these are just some of the type of partners you might expect to see at the table when you're working for a Department of Health or any other state body. Again, I would encourage you will not be able to work alone if you work for a state health department, or if you reach out to a state health department, you'll find that they can't work alone and make any real change. So These groups are also have similar goals and always look for a way to connect our goals to their goals. And if I'm helping others meet their goals, the chances of them reaching back and helping us to meet ours are much higher. So some of the traditional funding sources. So I mentioned this earlier, but um, it's limited. Injury prevention funding is somewhat limited compared to other health issues. And there's really three main buckets. So there's federal funds, state funds, or private partnerships. And federal funds, state funds. I mean, let's stick with federal funds for a minute. How injury prevention is funded in any given state will vary greatly. So we're just kind of taking a high level look here. But with federal funds, you may most states will receive some type of funding from HRSA, which is the Health Resources Service Administration. For example, they might provide funding for the EMS for Children grants, Maternal Child Health Block Grant, which is one that all states receive, or the TBI funding, which we receive in Tennessee. And the CDC tends to provide the funding for injury prevention, whether that's opioid prevention, NVDRS reporting system, suicide prevention, rape prevention and education. All those things are fundings that we have received or are receiving now over the years. And those funds are applied for by the state on revolving cycles. And your state may have been funded at one time, they may not be funded now, but there's usually a history there of states who have applied and received some type of federal funding if they've done injury prevention. Also, SAMHSA provides substance abuse treatment and funding through their block grant. And a certain amount of that money is dedicated to prevention. And then you have the Garrett Lee Smith Suicide Prevention Grant for youth suicide. So there's chances are someone in your state health department or your substances abuse or mental health state department are receiving one or more of these grants, and so you can connect to them. State funds are almost always set by the state legislature, and they can be focused on programs and services. They can have budgeting for staff, or they can not have budgeting for staff. We're very fortunate in Tennessee that we have received state funding in the past for suicide prevention, but those are a little more less common, and you'll just have to check with your state to see how each state, is different. Um, but most states use a combination of federal and state funding to make sure that they have appropriate staffing and implement the kind of programs that they need based on the data that they find. Some states are able to work with private partnerships, and it may be that some states may accept funds from private trusts or others, but your state may have a public health trust fund or some kind of fund like that, where you may be able to access those resources or work closely with them to see how that funding might impact things you're interested in. But for the most part, Department of Health are going to receive state or federal funding, and then they're going to use a portion of that funding to procure services with local agencies to meet goals that the federal funding source sets out, general goals, and they'll become more specific as they get more local based on local data. But don't be afraid to ask your health department how the funding works, and if they or any other state agencies have funding to support your particular interest. So, core competencies. If you go to the Safe States Alliance website, you'll see something about the core competencies for injury prevention, and I encourage you to do that. But I just want to share with you some core competencies that I see core competencies, excuse me, that I see that are important. I think, again, and I mentioned this, that coalition building and partnerships is really important. And then patience, because change takes time. And if you're going to be a good state health department employee, you're going to have to understand that it is a long game and nothing changes in a year. And that's a good thing. We don't want to make quick changes and overhaul budgets and change programs year to year to year on a dime. It's just not healthy for the system. Departments are slow moving ships. They take their time. They look at data. They look at annual data. They move with all deliberate speed because they want to make change. But patience is important. If you have that kind of patience and long term vision as you're working on programs, you're going to be much more successful in injury prevention at a state health department. But some other skills are important, and we kind of mentioned this, is grant writing and reporting and contract writing and contract management, especially related to that procurement process I talked about. Not only do you have to write the grant to the CDC or to another funding agency, but you have to write a scope of services and create a contract for the people that you're sending the funding to. And then you have to manage that funding, and you have to report back to the CDC how that funding is going. So there's a lot of reporting and contract management and grant writing. But it's exciting because you can begin to see things really happen at the local level based on the funding that you've received, and you start to see the data roll in. And so that's another area is uh, is data interpretation. So data collection and data interpretation. So you can decide on what should happen. If you're looking at data and you say, hey, this is we're seeing an uptick in this type of injury, we need to do something. So then you can plan for that and plan in the next year to maybe do some programming or uh, awareness and education around that issue. And so that's that data interpretation and sharing of data with partners so they can also make changes is important. And then communicating what you find. So you're communicating how well the program's going, communicating, how the documentation is going and what research that you're seeing, and how is the program administration piece working, and sharing that with partners and with up like I said with leadership. And so these are all the competencies that you would need is for working within a state health department. And I mentioned research, and so you want to stay abreast of the latest research in your area, and maybe perhaps contribute to research if you have done some successful programming. And we all try to do that, is contribute to the body of knowledge of injury prevention. And so it's not unusual for a state health department to publish a scientific article. Now, we don't do research in the sense of we're not funded to do research. Usually we're funded to do programs, but that doesn't mean we can't stay abreast of research and know what's happening, and also possibly share our work. So finally, just want to a quick overview of some of the technical assistance providers that work in the space of injury prevention. Some of them I'm more familiar with than others, but these are just to provide this, so you can know that there are others out there that can provide advice and guidance. And if you're starting your career in the state health department, or even if you got many years in the state health department under your belt, there's new and innovative approaches out there, and so I would encourage you to reach out to some of these. Obviously, the Safe States Alliance is probably the leader in terms of exploring opportunities in injury and violence prevention. Multiple resources at their webpage, and I can't not stress enough for that. To explore that webpage and become involved in Safe States Alliance, not just as a member, but as a board member or as a some kind of lead role. I would encourage you to get involved. There's also others that you may be aware of, like the Children's Safety Network, or which does collaboratives around the country on different topics. I've been fortunate enough to involve with them for several years. The Tribal Training and Technical Assistance Center, many others here listed that you can reach out to that are kind of specialized. But I really hope this high level overview of working in a state health department has been helpful to you. I hope that violence prevention can become a passion of yours, and I hope that you have a career where you are fortunate enough, as I am, to begin to see change and positive change. And I've been fortunate enough to work with wonderful mentors and mentees in this field, and I think you would enjoy it if you stay committed to it and really feel like you're making a difference. And I would like to just thank you for your interest in Safe States and State Health Department injury prevention efforts. And again, I hope you found some of this information helpful. And I look forward to meeting you in a webinar or some national space like the Safe States Conference or some other effort soon. Thank you very much.